Hello students, we will be discussing about the concept of health, wellness, and illness. After our discussion, each one of you is expected to be able to discuss health, wellness, and illness, craft your personal definition of health and wellness, describe the components of wellness, explain the different models of health, and identify variables affecting health status, beliefs, and practices. So what is health? Health is not just the absence or presence of disease. When we say health, according to Florence Nightingale, it is a state of well-being and using every power the individual possesses to the fullest extent. And then we have the definition from the World Health Organization that takes on a more holistic view of health. It says that health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. This reflects concern for the individual as a total person, functioning physically, mentally, socially, psychologically. And so we would like to take into consideration as well that our psychological or our mental processes affects how we take care of our body, how we interact with other people in our surrounding, and it as well affects our attitude in life, so that um, these components, physical, mental, and social well-being, works together to provide us a state of being healthy. This as well gives us an overview that health is also affected by the environment. Like we interact with other people, we interact with the environment as well. And so our life or our health specifically is affected by everything inside and outside of us. Okay? And in 1951, Talcott Parsons gave us another definition in terms of role and performance. So he said that health is the ability to maintain normal roles. So when we say normal roles, what is expected of you, what you should be doing at that specific point in time. If there is a disruption in your ability to maintain your normal roles, then you could be having sickness or you could be unhealthy at that point. Basing on those more prominent definitions of health, we can see that health is not a condition. It is not something that where we should be. It is an adjustment. It is a day-to-day, moment-by-moment adjustment on what is going on inside and outside of us. It is not a state primarily, but it is a process. And so the process adapts the individual, you and I, not only to our physical components, but also to our social environments or what's happening around us. And according to the American Nurses Association, it says that health and illness are actually human experiences. The presence of illness does not preclude health, nor does optimal health preclude illness. Now, being healthcare providers, we should also have our personal definition of health. Now, let me ask you, what is health for you? This leads us to two concepts we will discuss about wellness and well-being. So when we say wellness, it is a state of well-being. And well-being is a subjective perception of vitality and feeling well and can be described objectively, can be experienced and measured, and can be plotted in a continuum. That being said, your state of well-being is your personal perception. Like, for example, it doesn't mind you having or encountering problems or physical disability. Your sense of well-being is your personal take. Should you say that you are well or not? Now, when we say wellness, it is a self-responsibility. It means that as adult or having our own mindset, then we are now responsible for our wellness. It is an ultimate goal. It is something that we continuously aspire to achieve. It is a dynamic and growing process, just like our physical bodies, our environment. Nothing is static around us and inside of us. So wellness as well is a dynamic, growing process. Wellness is a daily decision making in the areas of nutrition, what you will eat, okay? And then your stress management. How do you cope with what's going on around you? Your physical fitness, your preventive health care, and your emotional health. All in all, it means the whole being of the individual. So our wellness is the whole being of us. Okay, so we have now here the 7 components of wellness. We have the environment, occupational component, the intellectual component, spiritual component, the physical component, the emotional component, and the social component. So all of these components affect each other, and together they provide us our own sense of well-being. So when you say environmental component, these are our ability to promote health measures that improve the standard of living and quality of life in the community. So that means influences within our environment that has a bearing or effect on our health would be food, water, and air. And then we have social component. This is the ability to interact successfully with people and within the environment, which all of us is a part, no? And to develop and maintain relationship and intimacy with our families and our significant others, as well as develop and practice respect and tolerance for those around us who doesn't have the same or who doesn't believe in the same way, no, that we do. Our emotional wellness component means the ability to manage stress and to express emotions appropriately. Wellness emotionally involves the ability to recognize, accept, and express feelings and accept your own limitation. When we say physical, that is the ability to carry out our daily tasks, like what you have to do for today, what's expected of you. Most of our tasks need work, right? Most of our tasks needs our physical component. So this is as well part of our wellness that we have to be responsible of. And then we have the spiritual component. This is our belief in something that is higher than us, a superpower, a supreme being that serves to guide us, to provide us what we need, and to give us purpose and meaning of our life. And this could as well include your values, what's important to you, as well as your ethics and your morals. Our intellectual component is our ability to use information for personal, family, and career development. So I think, no, this includes our ability to process what we learn as student nurses, so we will be better equipped after graduation for taking our board exam and then being professional nurses also. And then we have the occupational component. This is the ability to achieve a balance between work and leisure. So this could include like your education, your employment, your personal relationship as well, not only with your family, but also with your peers and with your companions in your workplaces. So all of these components, as I have said a while ago, works together, interacts with each other to provide us that sense of wellness. Now, what is illness? Illness is a highly personal state in which you, the person, assesses or thinks about your status when it comes to your physical, emotional, intellectual, social, developmental, or spiritual functioning as to be like diminished. So it is highly objective, but it is not synonymous with disease. So when we say an individual could have a disease and not feel ill, okay, so because that person doesn't feel ill, the person still thinks he can do things just like how he normally does. But it doesn't mean that a person feels ill, since this is a highly subjective state. It doesn't always mean that when a person feels ill, a person has a disease. Okay, so these two are very different. So illness is a personal state. It's how you see yourself, and it's very subjective. So it depends on how the the person looks at himself. If a person thinks that he is ill, he could either be meaning that physically he doesn't feel good, emotionally, intellectually, socially, developmentally. Okay, but illness should not be made synonymous with disease. When we say disease, okay, this is a state wherein there is an alteration in our body or physical functioning that results to a reduction of a person's capacities or a shortening of the normal lifespan. So what does that mean? In here, there is already an obvious alteration in body function. Okay, and this concept of disease many years ago by our ancestors was looked like caused by forces. Okay, so our ancestors believe that the diseases are caused by a punishment to persons, by spirits or forces. Okay, but today we know that what causes a disease is actually multiple factors interacting, right, to cause a specific disease. And of course, disease could also be determining how we look at it, how we address our diseases. This would as well determine how we are going to respond, no, to what treatment protocol would be provided us. Most diseases would have what we call as an etiology. Okay, when we say etiology, this includes the identification of direct factors or indirect factors that act together to cause about this disease. So like for example, we have communicable diseases like one of the most common here in our country or in the world right now is the COVID, right? So what is the etiological agent for COVID-19? It is the SARS-CoV-2 virus. So that disease, the COVID-19 is the disease, while the SARS-CoV-2 virus is the etiologic agent. Aside from the virus being the etiologic agent, we can also have like other factors, etiologic factors like age. So we would know now that those who have the younger you are and the older you are, the more predisposing you are to have this disease. Or like, for example, if your immune system is compromised or you have comorbidities, then that could as well add up to the etiologic factors. Okay, that would result to you acquiring the disease. So before, when people would think that these are just caused by a single agent or that, we now realize, being healthcare practitioner, that a disease is caused, no, or being present in the body not only because of one factor or one agent primarily, but it is an interplay of the different etiologic factors that could either be physically, emotionally, socially, or developmentally. Again, to reiterate, when we say disease, this is an alteration in body functions that could result to a reduction in our capacity, or if not attended to, a shortening of the normal lifespan. And a disease could have a specific etiologic agent as well as different etiologic factors. Okay, you might probably have heard about acute and chronic, right? So this refers to how we classify illness and disease. So when we say acute and chronic, this refers to the duration. Okay, so how long had the individual been feeling ill, or how long is the disease occurring? When we say acute, that means this is typically of a short duration. Symptoms or the feeling of being ill could either came abruptly and then just subsided, okay, depending on the cause or the intervention provided to the individual. When we say acute conditions, this would be actually from days to weeks or a few months, like up to 6 months. When we say chronic, okay, this refers to those that are longer, okay, or lasts for an extended period of time, okay. So when we say chronic, that means it has the duration would be for usually 6 months or longer, or sometimes for the rest of the person's life. Some conditions that are what we call acute would be like, for example, appendicitis. Okay, so it is an inflammation of your appendix, and so it is a medical emergency that it should either be resolved as soon as possible, or your appendicitis will have, or your appendix has to be removed. When I say chronic, this would mean like having diabetes for the rest of your life, or living with disability. Okay, so that could be considered as a chronic condition. Let's now go to the different models of health and wellness. One model is what we call as the clinical model. This could be considered as the narrowest interpretation of health, because in this model, people are viewed as merely physiological systems with related functions. Or what this model is considering is basically our physical aspect. And this model would take health as the absence or um, the presence of signs and symptoms of disease or injury. So you are considered healthy if you don't manifest or you don't show any sign or um, symptom of a disease or injury. Or in another sense, it is considered the state of not being sick. So when you don't have any sign or symptom, you are considered healthy. Now, for you to be able to consider having disease, okay, or being sick, then you should, or you are now manifesting sign and symptoms, okay. This clinical model is primarily used by healthcare practitioners to focus on the relief of signs and symptoms of disease. So like for example, if there is pain, the focus of the intervention would be to lessen or remove the pain, okay? And when the problem is gone, the pain is gone, then the patient or the client is now considered restored when it comes to his or her health status. Okay, the next model is the adaptive model. By the name itself, that it takes a look at health as being the ability of the person to adapt. Okay, so in this model, health is seen as a creative process, and disease would mean there is failure in adaptation, or there is maladaptation. So if, for example, in the clinical model, the aim there is to provide relief or to remove the, the signs and symptoms. Here in the adaptive model, the client now is experiencing maladaptation, or the inability or failure to adapt to the condition. So the aim here now is to restore the person's or the client's ability to adapt or to cope. Okay, so in this model, it would look at good health as very flexible. No? So if you can, if you are flexible, you are easily adapting to the environment and the changes around you and inside of you, then this model considers you as healthy or being in a state of wellness. So we have our famous model of nursing, which is by Sister Calista Roy, which is the considers person as an adaptive system. Okay, so here in this model, the main again, I would like to reiterate that the main goal for using this model in addressing problems in our client is to enable the client to adapt to the changes in the environment, as well as interact with the environment and cope with it. Here we have the eudaimonistic model. So what is the eudaimonistic model? This model incorporates a more comprehensive view of health. Here, health is seen as a condition of actualization, okay? Or the realization of a person's potential. For this model, actualization is the highest, no? The highest aim or the highest goal. Just like by the model of Abraham Maslow, the hierarchy of needs. So the highest point would be the fulfillment and complete development of a person's aspiration, which is what we call as actualization. So where is illness in this model? If there is a condition that prevents a person from being self-actualized or reach that level of self-actualization, then illness is considered to be present. Another model is the agent-host-environment model or the ecologic model. Okay, so this takes into consideration the three factors or elements, which are the agent, the environment, and the host. This is primarily used to predict illness than in promoting wellness. Although we can identify ahead the different risk factors that could possibly result from the interactions of these three elements. Okay, so the three elements are, again, we have the agent, the environment, and the host. So when you say agent, this refers to any environmental factor or stressor. So these stressors could either be biologic, chemical, mechanical, physical, or psychosocial. That could lead to illness. Its presence or its absence could lead to illness or disease. So like, for example, what are these agents? It could be your exposure to harmful radiation. It could be your exposure, or it could be a bacteria or a virus that could potentially, okay, cause disease in you. The host is the person who may or may not be at risk of acquiring a disease. So that person usually is our client. So we consider as well different factors affecting our host, which is the family history, the age, the lifestyle habits, or the exposure of our host, not to the different, to the agent. Okay, and then third, we have the environment. These are all factors external to the host that may predispose the person to the development of the disease. Like, for example, climate, uh, the living conditions, the economic level. So these three elements, the agent, which is the etiologic agent, or any factor that could affect the host, its presence or absence could affect the host, and the host is the person that could develop the disease, and this is as well affected by the environment or anything external to the host. So these three elements, the agent, the host, and the environment, place together dynamically. No, they interact with each other to either result in a state of disease or illness. We have as well the health illness continuum. In this model, there is a grid, no, or graduated scales that has two opposite poles. The other side would be health, and the other side would be illness or disease. So in between would be how the person navigates. Okay, so from a high level of health, a person's condition can move through good health, normal health, poor health, and could eventually lead to death. And according to this model, the health illness continua, that every person moves back and forth within this continuum every moment and every day of our lives. So there is no really distinct boundary across which you can move from health to illness. You just navigate from one point to the other. Next, we have the Dunn's high-level wellness grid. Okay, so if you can see here, there are two axes. We have the environmental axis and the health axis. So for the environmental axis, we have very favorable environment, which is the ideal. And then the lowest portion would be the very unfavorable environment. Here in the health axis, the highest would be the peak wellness, and the lowest would be the death. Okay, so in between the different points of our two axes are the different grids. Okay, so we have the high level wellness in favorable environment. We have emergent high level wellness in unfavorable environment. We have poor health in unfavorable environment, and we have protected poor health in favorable environment. So what does that mean? So like, for example, if a person, a young person who practices a healthy lifestyle, who doesn't have any existing conditions, and lives in a very favorable environment, like he or she has the resources to maintain the healthy lifestyle. She has the resources to get proper nutrition, then that person could be considered in this grid, high level wellness in favorable environment. So we are considering as well being well, having the peak wellness, and having that the resources that can provide you, like economic resources to sustain a healthy lifestyle, as well as your support and emotional support that you can find within the environment. then that person is considered to be in the high level wellness in favorable environment. Okay, and so we have another here, the emergent high level wellness in unfavorable environment. Like for example, um, a mother who is in her peak wellness, okay, but self-care or personal care is being set aside because of different responsibilities in her job, in her household. So the woman sleeps late, doesn't have any day off. So that person could be considered in an emergent high-level wellness in an unfavorable environment. So our goal here, if you're taking care of this type of client, is to move this client up here. If not, then we can probably discuss with the client how to, what to do with her unfavorable environment. And then we have here protected poor health in favorable environment. So that means there is a disruption in the health of the person, but that person is in a favorable environment. Like for example, if a person is already diagnosed with diabetes, but the person is in a environment where he or she can have access to appropriate medications, appropriate support, then that person could be considered in protected poor health in favorable environment in this grid. Now, what about if like we have a person who is diagnosed with like tuberculosis, but that person is not capable or in an environment where he or she cannot take care of herself properly because of lack of resources, or there is no near facility to assist her. So that person could be considered in poor health, okay, and in unfavorable environment. So what do we try to do? We can either move, okay, the person into this grid and then eventually to this grid. So this is going to be our what do you call this? Our goal, no, for each of our clients if we are using Don's high-level wellness grid model. Another model is the illness wellness continuum. So here you can see that there is what we call as an arrow, right, pointing to opposite direction. On this side, okay, is the optimal health, and on this side is premature death. And so what does that mean? In the middle, we have the average health. Say, for example, we would like to guide our clients to move here on this side of the continuum. So that is through providing health knowledge, disease prevention, health promotion, as well as positive attitude. So going there, okay, for optimal health. So like, for example, if we would like to encourage as well, for example, our client is already here in the illness spectrum, then we can guide our client to move to this side, okay, from illness to wellness. Of course, this has to be like with the full cooperation of your client as well as your guidance, okay. So basically, this illness wellness continuum would like to tell us to move, no, to move our clients to this side nearer, no, the nearest point that they will have towards optimal health or wellness. Having discussed the different models on health and wellness, let us now discuss the factors affecting health and illness. First, let us define these very important terms. When we say health status, that is the state of health of an individual at a given time. Health beliefs refers to the concepts about health that an individual believes are true. Health behaviors refer to the actions people take to understand their health state, maintain an optimal state of health, prevent illness and injury, and reach their maximum physical and mental potential. Okay, there are internal and external variables that affects health and illness. So we have for internal variables, we have biologic factors, psychological, and the cognitive. For the external variables, we have the environment, standards of living, family and cultural beliefs, and social support network. Okay, one of the internal variables is our biologic dimension. So when you say biologic, that pertains to our genetic makeup, our gender or sex, our age, our developmental level. So this biologic dimension affects us. Like for example, our genes, so our genetic makeup is something that, well, we cannot really do much about. Okay, so that is something that we have to take note of. Like, for example, what are the biological characteristics of ourselves and our families? Because genetically, there are diseases that are related, no? Or what we call as makes a person genetically predisposed, no? To a specific diseases like cancers, diabetes. Okay, we have that. Like there are some group of or races that are more predisposed to hypertension, more predisposed to this specific type of disease. Okay. So like for example, we know the family history, the family history of our client, then we can start informing them about the different predisposition that they might have to specific health conditions. And then we have the sex or the gender. So we have diseases that are more common in females than in males. Okay, so we might have like for example in females we have more cancers, breast cancer, but in males, it would be more like different types of cancer as well. So it is important to know the sexual predisposition of your client, okay, so that we can assist our client how to address these variables that could lead to them being predisposing to a specific illness. We also have age. Okay, so there are some diseases that are more commonly occurring in like specific age group. Like for example, what are these conditions that predispose? Like young children are more predisposed to what we now call as common childhood illnesses. Okay. And then we have the occurrence of lifestyle diseases that are commonly found in adults. We have osteoporosis, which we commonly find in older adults as well. And we have what we call as the developmental level. This has an impact as well on our health status. So like for example, the infants, no, or very young children, they don't have the physical and the psychological maturity to defend themselves. So this predisposes them to uh, different infections as well as to different conditions. We have like the teenagers who are very prone to, what do you call this? Very prone to experiment. So they might develop specific diseases that could lead to, or conditions that could be a result of experimentations when it comes to their sexual orientation, their sexual practices, as well as due to peer pressure. So these are what we call as our biologic dimension, no? One of our internal variables. And then we have psychological dimension. So when we say psychological dimension, these are psychological or emotional factors influencing health, and that includes our mind-body interactions and our self-concept. So when we say mind-body interaction, this is how our mind and our body work together. And most of the time, like for example, what you are thinking in your mind, you might no manifest in your body as well, no? For example, if you are extremely anxious or afraid, then a person might develop diarrhea or urinary frequency. Okay, so or some persons who are about to face a very stressful event like surgery or like a separation. Okay, so some would develop like allergies, no? Allergies in their body. So this mind-body interaction is one part of your psychological dimension. Another one is your health concept. Okay, self-concept is how a person feels about self. Okay, so how you perceive yourself is your self-concept. And how does this self-concept affect? Okay, it affects our health because it influences how we view and handle our situation. So like for example, someone who is anxious would do stress eating. Okay, so instead of choosing well nutritional intake, stress eating with junk food. So from being nervous about a specific event, okay, so it would as well affect our self-concept. Like for example, we have cases like those person who think that they're very fat already could develop what we call as eating disorders, okay, like anorexia or bulimia. Okay, so it is very important for us to have a healthy concept of ourselves. We also have the cognitive or intellectual factors influencing our health. And this includes our lifestyle choices, our spiritual and religious beliefs. So when I say lifestyle, this refers to a person's general way of living. That includes your living conditions, your patterns of behavior, that are influenced by sociocultural factors and personal characteristics. So when we say lifestyle, this is these are our behaviors and activities that we we do no regularly. So our lifestyle choices could have either a positive or a negative effect on our health and well-being. Okay. We have other what we call as risk factors, no, for our lifestyle choices, like for example, overeating, what not getting enough sleep, okay, could be our lifestyle choice that could have a negative effect to our health. And then we have our spiritual and religious beliefs. So there are some uniqueness in different religions and spiritual beliefs that could affect us, no? Either it could affect our lifestyle, like in our um, diets, in our activities. So like for example, we have some religious group who doesn't eat meat, okay, or who doesn't eat pork, or who doesn't eat specific types of food. So their belief could either affect, no, their lifestyle choices as well. So these are your cognitive dimension in your internal variable affecting health and illness. So for our external variables, we have the environment. So in the environment, we have these different factors that could affect us. We have the geographical location, we have pollution, we have radiation, and the greenhouse effect, among others. How does our geographical location affect us? First and foremost, it determines our climate, and our climate affects health. So like for example, here in our country, we're in a tropical location, so most of us might be familiar with the occurrence of um, mosquito around us. We have different mosquito-borne diseases like dengue and malaria. Okay, so wherever you are in the world could affect, no, your level or your health and illness condition. Pollution. Like we have pollution in the water, the air, and the soil. So it could as well affect us. Any pollution occurring in the air could directly affect our respiratory system. Okay, and then we could as well have like pollution resulting from burning of garbages, burning of which could result to pollution in the air, right? So it's very important as well. Like the presence of harmful chemicals that could cause specific conditions because they are carcinogenic, so they could cause cancer. Like if you are exposed to tobacco smoke, okay, or cigarette smoke, which we know is um, hazardous to our health and can predispose us to lung cancer and other cancers, okay? So it's very important to know this, no, type of pollution that we and our clients are exposed to. Another one is radiation, okay? So radiation, if like for example, we are always exposed to radiation, they could be carcinogenic as well. So it could like create diseases in our result to diseases in our body. And we have radiation source. We have the sun, no? Like for example, if you are constantly uh, exposing yourself to the harmful rays of the sun, then you might predispose yourself to having specific skin conditions, okay? And then we have this greenhouse effect, which is the accumulation of carbon dioxide in our atmosphere, which we know that carbon dioxide in high levels are very harmful to our body and to the environment too. So the carbon dioxide, the greenhouse effect not only is about carbon dioxide. It is also about increasing our atmospheric temperature, which could result to global warming and a myriad of other situations. So another one, external variable is the standards of living. Okay, so that would include the client's occupation, the income, and the educational status. So we know, like for example, your standard of living, that your occupation could as well determine like the level of income that you will have. So this would probably result to you being able to provide, no, having the resources to reach or to achieve um, higher level of wellness. Okay, so that your standards of living could as well be something that would determine, no, your capacity to assist you when it comes to aiming for your health. So we know now that low income families, no, have difficulty supporting when it supporting their health status. Like for example, when it comes to their nutrition, they would just have to choose food that they can avail of based on their income. Okay, and here in the country we have a higher rate of poverty as well as poor educational or low educational status. So when the more education that we will have, it is expected for us to know more about how to better take care of ourselves, and at the same time how to take care, no, of our families. We can see that those families who have to belong to low level of education, low income status, affecting their occupation, most of them live in challenged areas, or what we call as squatter areas. We can see there like their living condition, the sanitation, the hygiene, and of course, their capacity to support their personal and their family's health. And then we also have family and cultural values. Okay, so this one, where we grew up would affect us the patterns of our daily living. Like how does our family train us? How did they train us? How did they live their lives, their daily lives? So that affects us, no? Because we are influenced by our family and cultural beliefs. That would also includes an influence in our lifestyles, in our how we do things, how we perceive things, and that as well includes mindset. And then culture and social interaction. We have several groups of people who have strong social and social-cultural sense of family and community. And right now, it's very important to have that, especially in at this situation that we are in. So for our family and cultural beliefs provide us a support as well as an influence, no, of what what we got to do and how we are going to go about our daily living. And that is true with your social support network. So that includes your family and friends, your job. So this external variable would provide us where we go to, what kind of support we get. No, it's very important because this social support network that we have allow us a venue to ventilate ourselves, to get assistance and also help if we need to.